Hello, everybody. I'm here with Grace Kwok. We met almost 2 years ago, and she asked me to help her with her diabetes care, and she asked me to help her with home care. She thought there were some issues she needed help with, so I offered to look after that the best I could. And so now she has basically beaten her diabetes,
Yes.
reversed her dementia so she can take charge of her own life within reason. At least she's 78. She's not young, right? But she's amazing, better than most people, still does more than most people in 6 months than most people do in a lifetime. And she also told me as long as she could be a contributing member of society, she'd be willing to be alive. So here we are today living a beautiful life. Hey, Grace?
And working very hard.
And working very hard. So what would you say about your progress?
The progress from, of course, from a sick, weak old lady. Now I am more confident, stronger, and no doubt about what to do is the right thing. You gave me so much guidance.
Very, very.
Yes. So whenever I have a question, I ask my coach.
I'll ask your coach. Well, that's good, but it's all about independent living and living your best life and giving you a great environment, right, Grace? So I'm gonna just go to the movie very quickly, then we'll come back and have a little closing discussion. Is that okay?
Definitely.
Okay, thank you very much. Let's see if I can get this right. So here we are here. And this is from the National Library of Medicine. And it's talking about a 2-year multi-domain intervention of diet, exercise, cognitive training, and vascular risk monitoring. So what we did is we got Grace's very high hyperglycemic levels under control. We got them in a band, and then we lowered the band slowly, and then we slowly started to change the diet and reduce the insulin. 2 years later, almost even less, the insulin is the Humalog from 50 to 60 units a day is finished. The Lantus you still take, but we broke it into 2 doses a day, half and half, 4 and 4 units each actually, so you're almost off that. And your metformin was 1 pill, you're now down to half, and we're reducing that, and you're becoming more and more clear every day. This is something we did not expect to find, though. We did not really know. I thought we could, and my new diagnosis for a form of dementia, they call diabetes type 3 the dementia, but I call it hyperglycemic. Because I think people, like a child, when they have too much sugar, they get a sugar high, they can't control themselves, nobody can control them, their brain doesn't work, they're manic. I saw in you that when your glucose got high, you also got manic. So I thought maybe over several months we could lower your glucose level enough that you would be able to get your reasoning and everything back, and it's worked. Hyperglycemic is my medical diagnosis, my medical term, and it shows you right here on this here that they did this whole test, and the interpretation findings from this large long-term randomized controlled trial suggest that a multi-domain intervention could improve or maintain cognitive functioning in at-risk elderly people from the general population. So it actually works. I'm not going to go through the whole thing, but it works so well that there's a global collaboration for future generations. It's an interdisciplinary network to share experiences, harmonize that. So what they're saying is that prioritize research in dementia prevention, reduce risk reduction prevention, pivotal managing dementia epidemic globally. So they want to put this in place, and it's the same thing. It's all based on diet and exercise. It's a finished geriatric intervention. The problem they say, actually, and you can do a little bit of your own research, but the problem they say is twofold. One, they say that too many doctors are necessary. They say you need a doctor, you need an endocrinologist, you need a psychologist, you need a dietitian, you need a nutritionist, you need a physiotherapist, and a personal trainer. Most of these jobs a coach can do. He knows how to look after your food. He knows how to understand your body, everything, right? So the thing is Alzheimer's Association worldwide, I've just shown you that this is very, very big, and it's been going on since 2014. They became aware of it. No wonder some people try to shut us down, because we're proving one coach can do it.
That's what I intend to say.
We're going to change the home care, and we're going to change elderly care, and we're going to give people preventive measures. So just to quickly do this one here, look at this. Grace was going blind from diabetic retinopathy, which I didn't know. She now has mild non-proliferative diabetic retinopathy. That means that we stopped it from getting worse, and you got a prescription to get eyeglasses, Grace. We did. That was a miracle in and of itself, okay? And then we're just going to show some of these things here. So this is the normal diabetes. A lot of money spent, billions of dollars a year. 25% live with diabetes or pre-diabetes. People with diabetes are 3 times more likely to be hospitalized with cardiovascular disease, 12 times more likely to be hospitalized with end-stage renal disease. Sometimes metformin can do that, especially depending on the pills you're taking. 20 times more likely to be hospitalized for a non-traumatic lower limb amputation. These people get their legs. It doesn't even talk about the dementia here. Doesn't even talk about the dementia here. 30% of strokes, leading cause of blindness, which we saved from you. 40% of heart attacks, your heart rate, everything is perfect. Dr. Bears, she made sure of that. She's very good. 50% of kidney failures requiring dialysis, and 70% of all non-traumatic foot amputations. We learned this, but this is very important. If you can keep your sugar levels between 6 and 10 before meals and 8 to 12 after meals, you're great. You don't really do any damage until after a measurement of 12. So as long as you're below 12, you really shouldn't even be taking insulin, because sugar, believe it or not, fries your brain. Sugar absolutely fries your brain. And Grace, because of her memory issues that are associated directly with the insulin and the diabetes, in my opinion, and in a lot of people's opinion these days, they're calling it diabetes type 3. This is your life-sustaining therapy report. And it says right here that you need diabetes care on insulin. Condition requires frequent monitoring of blood sugars, administration of injectable medication, as well as oral medications, calibrating necessary equipment, testing ketones. Can you remember when I started testing your ketones?
Yes. Now
Right?
stop.
That's because I was switching you over to a keto-friendly diet. And when I was switching you over, I had to make sure you didn't go into something called ketoacidosis. So now I'm just going to go a little bit further here, because obviously Grace did need all of this care, right? And when you go down here, we can see that it this is life-sustaining therapy, insulin therapy by injection from 2015. When I met you in 22 near the end of COVID, Grace, or in the middle, you were almost dead, really. We've done so well to do this. You found me, you explained to me, you told me you wanted me to help you fix diabetic care and home care, and if you could contribute to society, you'd be happy to be alive. It's an absolute pleasure to know you. So part 1 is the glucose, keeping it within target range, is 17.5 hours a week. Part 2, preventing you from going high and low, is 13.5 hours a week, for a grand total of 31 hours just for the insulin. And this is how it breaks down. It tells you how many times a day, how many minutes, how many days a week for everything. So I'm not really going to go too much into this, because we're trying to fly along pretty quickly. This here is a note, July 18th, 2022, last year. Accompany the patient's application for family managed home care. We were trying to apply and we couldn't get it, but this is a letter from your doctor. Great, your physician says 2010. Have some hypertension, which would raise your glucose. That's why we'll get into in a few minutes something else I like to do. Diabetes, more recently mild cognitive impairment, and then after that another doctor, Dr. Ring, diagnosed you with dementia. So you have a companion, Coach Mark Hayden. January 2022. It was actually late 2021, early December. So I've been supporting her by counseling around proper nutrition and helping with meal preparation, monitoring and supporting proper medication timing and dosing, providing emotional and physical support. Since our partnership, Grace's zl3se has been under better control and feels generally well supported. Mark visits and calls Grace multiple times a day. Remember back in the beginning, I'd have to come here at 5 o'clock in the morning because your alarm would be going off. Back then, I didn't know that your body automatically produces extra in the morning before you wake up. So I didn't know that, right? So a lot of people have to be careful when they get tested because in the morning it just jumps up automatically anyway. And says we are adamant, which goes along to the life-sustaining therapy we just saw, so that Grace requires very frequent and sometimes unscheduled visit to support her diabetes management, right? And we all know that's true and that's what you needed. And then we have a letter here actually from Home Care, Central Patient Experience Home Care, that says, we do not have policies or procedures specifically for seniors with memory issues and insulin requirements. Home care cannot look after you at home because scheduled visits will not meet your needs. You need assisted living, which is in between, and it's possible that one day you won't even need the assisted living, Grace. That's what I hope, and that seems to be where we're heading. You're doing very, very well on your own. So then, this here, just to quickly go over it, okay? We want to be kind of quick. Family Managed Home Care, Home and Community Care Central. Who is eligible for Family Managed Home Care? Patients in extraordinary circumstances. Who are patients in extraordinary circumstances? Extraordinary nature, frequency, and intensity of care required, and unique scheduling issues. Your scheduling issues are very unique. They cannot manage it, and they cannot come. Your alarm was connected to your phone, which was connected to my phone, right? So I would get the alarms. Who can do it? An individual, 18 years old, maintain insurance, have a valid CPR certificate, be capable, and pass a police vulnerable sector check. It says here you have to be in good standing with your regular college in case of a professional service. So I'm capable of all of this, and we've proven it out beyond the shadow of a doubt. And this here is assisted living services through home and community care also. And assisted living services support people who need a greater level of service than what home care can offer, but without the medical monitoring or 24/7 nursing supervision provided in long-term care homes. You fall right in the middle, don't you, Grace?
Yes.
You have to speak up a little bit. But you understand that, right?
Yes.
And you understand that you're getting better. You're going to be able to do it with
Of
less
course.
care in the future, but really, 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 you are so exemplary. So these services are most often, but not only, provided in settings such as supportive housing and apartment buildings or where clients live close together. This enables care to be provided as a drop-in or as needed basis instead of scheduled visits, which is exactly what you need. So the supportive housing, I don't agree with them putting 3 people in a room or 2 people in a room and that type of thing. I believe, like, if you went to stay in your own condo is number 1, but even if you have to go live with somebody, I believe you should go live with a family in their home. No more than 1 or 2 people like yourself, so that it's easy to manage the costs without cost overrun, because it's a set fee up front. Then somebody can pay for additional services out of pocket if they want. But also I think you get the one-on-one care that you need. You need the one-on-one coaching, right? That's very, very important. So it's high-risk seniors, which is what we already mentioned, people with dementia, right? People with dementia and insulin. And these are supportive services 24 hours a day, 7 days a week, scheduled and non-scheduled. And then there can be some care coordination between assisted living services and home care. So for example, I wanted to bring a physiotherapist in just to support what I'm teaching you with your stretching. Like I showed you the figure 4 stretch to fix your sciatica recently, right?
Yes.
I showed you another stretch and got you a massage to fix your carpal tunnel syndrome, right?
Yes.
So you're doing really, really well. But sometimes there is a need for us to ask an expert for help. And definitely, there's often needs to go see Dr. Bears, to go see your doctor, right? So we don't need to go through that again. That's just where I'm asking them about their policies. So then we come down here, and this is going to be the last part we're going to talk about today. And this is your discharge summary. We're not going to talk about all the subjective things that they said in the beginning. But what we are going to go is we're going to look at the results of the testing. See, these are the results, the radiology results, right? Because we want to show that we've stopped you from getting sicker, and we may have even started to cure it. So there was a mild to moderate generalized enlargement of certain spaces within the lobar predilection. So a part in the brain has some spots, but they're similar to that seen on an MRI scan in 2018. So you haven't gotten any worse since 2018, but I think when I met you in 2022, and I think even this year, you were quite a bit worse, but we've been reversing it. That's what I believe. There are, see this? Relatively and faint patchy low density, but it says these are previous similar in extent and degree to the hyperintense foci seen in the FLIR images of the previous MRI scan, not significantly changed. No change since 2018. No evidence of any problem in here. Summary, moderate bilaterally symmetric cortical atrophy. Means the brain is starting to break down a little bit, but it's stable since 2018. I think your brain actually got better. So, unchanged. They keep using the same as 2018 and unchanged, Grace. So you're basically a miracle. You basically did everything you said you wanted to do, and you're amazing. You're amazing. So then we come down here, and there's some spine shots. They took some spots. You have a little bit of scoliosis in your low back, but I tried to teach you to stretch, and you will help that a little bit, and you know you are. You can see they say there's no vertebral compression and fracture. There's no erosive or inflammatory sacroiliitis. That means on top of your tailbone where I have a lot of problem. And your pelvis and hips, minor early degenerative changes, no acute bone injury. And you're 78, you're very strong. Your chest x-ray, comparison made with 2017, the heart is unchanged. Nothing is unchanged. You're all the way back to 2015 as far as your heart. And then this is past medical history. They say you have vascular dementia. Okay. Which I actually diagnosed over a year ago myself, but I don't think you have it anymore, Grace. You're able to go and focus and deal with banks and everything. They're saying you have type 2 diabetes M. That means no more insulin requirements. They tried to take you off the last little bit, but we spoke to them afterwards and they allowed us to continue with our program. Thank you to Dr. Bear. She's amazing. But they're saying right there, you don't need insulin anymore, Grace. They're saying you're basically almost cured, right? So we did a great job. And then you have hypertension, which will raise your glucose levels automatically, right? That's why I tried to get you to take the marijuana oil, and I'll show a Mayo Clinic magazine talking about that in a moment. And it says you have a little bit of PTSD, which is why people like you deserve continuity of care. You don't need 7 or 8 people coming to visit you all different times. You can't even remember the appointments causing you stress. That's silliness. Left carpal tunnel syndrome, that's your arm that hurts down your arm. We fixed that with a massage basically, right?
It's better.
Yeah, it's better. She's amazing. You have a little bit of decreased bone mineral density, not too much. And I don't think you have this other stuff here, but anyway, that's okay. I don't really know. And then you got the new medicine follow-up to talk about please reassess the insulin therapy and everything. And here's your patient instructions, and here's your start on your following and stop the following. See, the Humalong we already stopped, right? The only new medications they gave you after your few days in the hospital, Tylenol extra strength and a multivitamin. We were already giving you the multivitamin. So they didn't give you anything extra. And you did leave against their wishes. They signed you in under an emergency and you left against their wishes, right? Against their direction. But that's because you were totally capable of looking after yourself. Okay, so now I'm going to bring us back online. We can have another quick little chat. And we've started to understand the brain from many different things we've read. This is a Mayo Clinic about Alzheimer's, understanding Alzheimer's, right? The finger study we just found recently. And this is also the Mayo Clinic. And it's talking about the science and the benefits of, they're talking CBD. I've been using marijuana since I went blind and was dying from back pain. I went in 2000. I prefer the whole bud. I find the CBD just puts me to sleep. Sometimes I even grow my own marijuana. I can grow one that will make me active and able to volunteer and coach hockey and soccer, which I've done for 25 years. So I just want to come back to Grace. Even when they signed you in the hospital because they thought you couldn't look after yourself anymore, you were strong enough to get out. You demanded that they let you out, and they let you out. And when you came home, you had a cane and a whole bunch of medicine or a walker, and it was a little bit rough in the beginning, but with a nice figure 4 stretch for a few days, some ice, your back and your leg got better.
Yes.
And we start to live a good life. So tell me whatever you would like to say at this point, because I think we've proven we've proven that dementia can be reversed through lifestyle change of diet, exercise, that type of thing. And we did it by starting out to control Grace's diabetes. We looked at it as I looked at it as somebody, my new medical term is hyperglycemic dementia. So a child that has a sugar high has no control, right? The parent can't control them, nobody. They're very manic. When the sugar high recedes, they become their normal selves. So with somebody like Grace, who's had high glucose levels for many years because of her diabetes and her insulin use, and no way to burn it off, I knew that it would take, I told her in the beginning, about 2 years. We could have been quicker if we didn't have interference and if we would have had a little more help. We're not even to the 2-year mark quite yet. But by mitigating her diabetes and her glucose levels over several to many months to a year and a half, 2 years like the study says, we not only give you a healthy body, but you have now achieved a healthy mind again, wouldn't you say, Grace?
Beginning.
Even your memory, even your short-term memory is getting better, isn't it?
Yes.
It's incredible, Grace. I'm going to give you the floor. I'm going to shut up for a minute.
No.
Please, just tell me something that you would like to tell the people, because they can prevent it by not going high glucose levels for too long. They can prevent the dementia. Some people living alone, right?
You have provided everybody with the steps, the procedures we have taken. You have had me take to improve. I won't be able, of course, we get professional to, from my own mind, share the information. I have to continue under your guidance.
Okay, Grace, that's fine for now. But you are becoming more independent, though, and you are becoming able to function and fix things on your own.
I would be shameful if I'm not.
Well,
With your careful coaching.
So what we're saying is that dementia can be repaired by one person. You don't need a team. It is affordable. It is doable. It is preventable. You can prevent it on your own by following a few rules and looking after yourself.
And continuation of following the guidelines.
Continuity, Grace,
Yes.
continuity. Not every day. I don't want to exercise, believe me, most of the time, but I still do. I don't want to stretch, but I still do. When I was young, I did it to look good. Now I do it so I can keep moving. But that's okay. I still do it.
I want to emphasize it is very effective. The coaching steps and procedures are very effective. However, there's no shortcut. Keep in mind, it takes time and lots of working together with your coach. It just don't come overnight.
No, it doesn't come overnight, Grace. And there are setbacks, and there will be setbacks.
I made it with his help, but I think that the important piece of information I like to share with everybody, in order to be successful, we need to have a very detailed, patient coach.
Well, thank you, Grace. So hopefully, now that we've gotten this far, and you've actually recently given me power of attorney for personal care, which you can revoke at any time, but it gives me the ability now to apply for some home care, family managed or directed funding. And because this has been basically a voluntary, there's no money here, right? We're not getting any assistance from anybody. But the good news is, Grace,
Yes.
the book is half done, and the course is half done, and we're going to help 100 million people, and we're going to help a ton of little old ladies just like yourself. And from the book and the course, and from helping all these people in the world, I should be able to make a living and get the quality of life back that I once had. And I want to thank you from the bottom of my heart for giving me the opportunity to work with somebody that's so exemplary and so stupendous, as is documented throughout your life by government officials that you provided answers to. Thank you, Grace. Thank you.
Okay. May I use this minute to thank everybody who has helped me. It is a long, hard-working process, teamwork from my medical doctors, Dr. Erin Bruce.
Yes.
And all her professional staff, and also coach, Mark Hayden.
And we know that one person can do it. Or two people, whatever. We don't need too many. Sorry, Grace.
It's a lot of teamwork.
Yes.
And it's worth though, because I'm now at my very senior age, yet I'm better and healthier than when I was young. I'm getting much better. I feel strong enough to look after myself better. Thanks for the consistent, hardworking team. Dr. Erin Bruce and her team, and also Mark Hayden. Never a day or a time he would not answer all my questions when I'm in doubt about what is the right thing to do. He never, no matter what hour,
Grace, you gotta
no
speak
matter
up.
what hour of the day, he's always there to answer my question.
Perfect.
Thank you.
Thank you to everybody. Wish us luck. We'll wish you luck. Let's help each other help each other.
More healthy people.